So this is the instrument that is required for AJ stitch. So this is a handle. Okay, this is a handle. The handle has a rotating knob. So this rotating knob will give you adjustment in the length of the piercing length of the needle. Okay, this is the, I'll show you later on as well. So then it requires a plastic tube, which is basically a stopper. You need a 1.4 mm needle. This needle has a slot or groove which will adjust the anchor. Then you need a knot pusher, and here I'm going to demonstrate on the meniscal pug. This is the basically AJ stitch. So AJ stitch has a 2 anchors in a 20 suture. So this is a 20 suture. It has a number 5 anchor, one in the loop design. So you can see here, this is in the loop design. This one is in the thread design. So this is the AJ anchor. Okay. So I'll show you how to fit this. So this is the needle. So needle will go into the knob, and then you have to rotate. So it has a thread here. It has a thread. So this thread will go inside, and then it will lock. So rotate till it locks, and then so that it doesn't rotate at the time of insertion, you have to tighten it. So once you have tightened it, then you pass the plastic tube, fit into this one, and then you can see here, this is your 15 mm, and then 16, 17, you can calculate how much depth you want to go. So here, if I rotate on this direction, this is moving forward and it will shorten. Okay, so this is shortening. You see that the tube is going that. If I rotate on this side, it is lengthening. So usually we keep at 20 mm. So this is a 15, and then this is the 20 mm. Usually we keep it 20 mm. Remember that this length should be adjusted based upon the size of the meniscus and the point of insertion in the meniscus. If you are inserting in the periphery, you may need a smaller one. If you are inserting from the center portion of the meniscus, you may need to make it bigger. So for a demonstration purpose, I am going to rotate this to a bigger size. Here also you can feel the click, which means 1 mm has traversed. Okay, so this is lengthening. So suppose, for example, we take this. If you want to go through the meniscus first, then you have to use a loop first. If you want to go into the capsule first, you have to use the line suture. So this is the line anchor. Okay, so here I'm going to demonstrate how I fit this into the so this is the anchor. So the anchor has to be fitted into this groove. Okay, so this is the groove. So you fit your anchor, and then you do this movement so that it sits into the groove. Then bring it back and fit into the anchor. So this is anchor has been fixed. So this is the loop one. We are going to deploy in the meniscus first. Okay, so this is the line anchor. So this is the meniscus. So we are going to demonstrate how it is going to be deployed. Okay, so this is the meniscus. So if I want to make a horizontal, here I am going to demonstrate a horizontal mattress. So you go inside, deploy, and this will preserve the depth. This is what I want to see. Okay, so this tube is depth preservation, which can be altered by the rotating the knob. Then you disengage this, and then you pull out your anchor. The first anchor has been deployed. Now next thing is you pull this and then deploy an anchor. See that the first anchor is deployed. You can see here the first all suture anchor is deployed there. Next is to fix this. So this has to be loaded now. So you pull this so that this is short enough and this limb is long enough. You pull this and then deploy, load the second anchor. Okay, so this is the second anchor. So again you make it like a loop, take the device, again load this, do this movement so that it sits nicely, and then you bring this and fit into the suture holding. Okay, then it's time to push the second anchor. So now I'm going to demonstrate the horizontal mattress here. This is the second anchor deployed. Then zoom out. It has to be disengaged, and then you take this out. Okay, so both the anchors are now being deployed. Next is to pull this one now, this one, so that your anchor goes and then sits there. I'm going to show it little slowly. So I pull this, and you'll see that the anchor is going to deploy. Okay, so once this is done, you can pull this. Since it is a loop in real meniscus, you can pull this and see that if the knot is sliding or not. So if these sutures are sliding, you can apply a sliding knot like this one. So in this one the knot is sliding, so we'll make a sliding knot here. So this is my post. I make a SMC knot, pass this. So this is my SMC knot. This is my SMC knot. Okay, and then you can pass this, and then you can gently pull so that your knot is deployed. You can see here your knot is deployed. You can tighten this, and then you can use a knot pusher. This is a knot pusher, so you can use the knot pusher to push, and then you can lock the anchor. So if you want, I'll zoom out. If you want, you can add some half hitches. I usually add 1/2 hitch, and then you do a pass pointing so that knot is done. And next thing is to lead. You can use a cord cutter. I don't have cord cutter here, and then you can cut this. So this is your easy stitch. You can see here, this is the anchor, 2 anchors deployed, which is nicely sitting here, and this is the suture which has been applied horizontally. The first step of the meniscal repair is the good and thorough diagnostic arthroscopy to identify other associated lesions and to analyze if the repair or if the tear is repairable or not. In this case, patient had a ACL tear, and along with the ACL tear, you can see the patient had a posterior horn medial meniscus tear as well in the red zone. So here I am trying to probe and confirm the repairability of this meniscus tear. So first thing is to take the AJ stitch handle, which comes in a sterile pack, and this handle is reusable. It can be autoclaved. So as I said, you can rotate the knob so that you can adjust the length of the needle which is going to pierce the meniscus. The needle and the plastic tube comes again in a sterile pack. It is a disposable one, so you can use for one patient. So this is the basic requirement for AJ stitch: a handle, the needle, and the plastic tube. The anchor, AJ stitch anchor, comes in a sterile pack which has a line suture with 2 centimeter long sleeve of anchor, which is of number 5 size, and the second one is the loop. So first you start assembling the AJ stitch device. Take the needle and screw it in. So to make sure that it is tightly screwed in, you can use a artery forceps to screw, and then you pass the plastic tube above it. Once the plastic tube is passed, then you can see that by rotating the rotation knob, you can adjust the depth which is required to pierce. One thing here you have to remember that the depth has to be measured based upon the size of the meniscus and the entry. In this case, you have to go 1 centimeter deeper than the usual all inside devices because you have to deploy the anchor all the way beyond the capsule. So now pass one limb of the suture. This is 2-0 suture, high, ultra high molecular weight suture. The loop is then engaged into the groove or the cut into the needle. Then the limb is fixed into the suture fixation post. So once this is done, your anchor is ready to be deployed. So this is the first anchor which is ready to be deployed. Now again, after doing the diagnostic arthroscopy, a small cannula is inserted based upon the accurate attack portal. So in this case, the cannula is placed into the anteromedial portal. Then it is important to use a probe to identify the trajectory of the AJ stitch so that it is safely away from the vascular area, and also we have to identify either we need to bend the needle or not. This will help us, the probing will help us in identifying all these things. So now the first stitch goes through the cannula. This is a 5 mm arthroscopic cannula. And since the loop has been placed first, as I already said, loop has to go through the meniscus substance. So you identify a better spot and then go through the meniscus. You'll feel a loss of resistance. That means you have pierced the meniscus and the capsule. Then you disengage the suture and take out your AJ stitch handle along with the needle. Then you pull the suture, one limb of the suture, so that the other limb is long enough to be deployed and to be engaged into the AJ stitch handle. So this is the second anchor which has been now engaged into the needle and fixed into the suture post. Now this is ready for the deployment. So you go through the same cannula, try to avoid entanglement with the suture so that you go from one side, and this is for the peripheral placement to identify the hard tissue in the periphery and then push until you feel the resistance. One thing important to note here is the depth has to be adjusted to 18 millimeter when you are passing into the periphery. So once both the anchor are deployed, then you pull the limb of the suture so that the loop goes inside and then the repair takes place. So at this stage you can do a seesaw of the suture. So if it comes very easily, you can apply a sliding knot. Otherwise, if it is tight enough, then we can wait, or we can apply a simple half hitches. So here I am trying to demonstrate a simple half hitches in this particular case. So first you make 2 passes. This is the 2 pass. and then take a knot pusher. There is a special small knot pusher, but in this case I'm using a ordinary knot pusher which is used for the shoulder surgery. And then pass your knot inside and tighten it. So since it is a simple suture, we use around 4 to 5 alternating half hitches. So I am playing the full video, unedited video of this one, so that you can see that the alternating half hitches, how it is passed. If possible, the knot has to be on the capsular side, but here to demonstrate how these knots are applied, I have placed in the meniscal side. So since this is a 2-0 suture, it doesn't matter much. So this was the fourth one, and I am applying the last fifth one. So you can apply up to 4 or 5 half hitches. So once this is done, now we can cut this suture and the first stitch is applied. So now to apply into the more anterior area, we have changed and placed our cannula into the anterolateral portal, and the scope is in the anteromedial portal. So since the loop is been used first, so I go into the meniscus. Again the same process, you push it hard so that you feel the loss of resistance, and make sure that your depth is well measured and well placed into the needle and the cannula. So this was the first anchor of the second stitch. So I'm just playing the intra-articular video, and outside we are loading the anchor into the needle and fixing the tail of the suture into the suture post. Then comes the second pass. So this is the second pass which is coming. It is important to follow how the needle comes from the cannula, because if it gets entangled into the soft tissue, the anchor may dislodge. So once it has come inside, again this is going into the capsule. I felt the resistance. I went to the desired depth, and then you take out the needle and the tube after disengaging the sutures from the suture post. So now I'm going to remove, and then again pull one limb so that you can see that the loop goes and the repairs the meniscus. So here again it is important to do a seesaw. If your suture is sliding nicely, you can apply a sliding knot. If the sutures are not sliding, then you have to apply a alternating half hitches. So here I am going to apply a alternating half hitches. So this is double half hitch. It goes inside, then I apply a knot pusher, and then with the knot pusher you tighten your suture. So this has been tightened now. Now I pass 3 more alternating half hitches. So this is the second. So second should be good and tight enough, and then third, so this is third. I'll apply one more, and in this case 4 alternating half hitches has been applied. So this is the fourth. Now I use a cord cutter so that I cut the sutures, and this completes my repair. So here the cord cutter comes, cutting. So in this case only one cord was cut, and then I can do a second pass so that the other limb is also cut. So this finishes the meniscal repair with AJ stitch. It is important to do a palpation or probe the adequacy of the repair. You can see that it is nicely repaired. Thank you very much.